Hello friends, so today I am back with another topic, and this topic is called as IIH, that is Idiopathic Intracranial Hypertension. Now it looks very confusing topic, but just to tell you in brief, this is a condition where people have just headaches and no other symptom, but many of them, if they are not treated, they can lose their eyesight. And as you can imagine, eyes and the vision are the most important functions that we have to lead a normal life. Without eyesight, what can we do? Nothing. So what is this condition where people have headaches but there is a threat to the vision loss, and why does it happen? So as the name suggests, idiopathic means the exact cause is not known. Intracranial, so inside the brain the pressure is high, and that, as you can know, that our optic nerve, that is the vision nerve, it's a direct extension of the brain. So there is increased pressure on the optic nerves or vision nerves, and that over a period of time it causes the nerves to dysfunction, and then the visual loss occurs. Unfortunately, the vision loss is painless. People don't have any pain. So many times they ignore the headache, saying that the headache may be due to tension, maybe due to migraine. They don't see the doctor, and then suddenly they start losing vision, and then they come to us. Now when the vision loss has already occurred and then we start treatment, we cannot get back that vision. So that's the most important thing. So what my message here is that it is a very simple message. If the headache is, say, lasting for 1 day or 2 days, of course you are free to take over the counter painkillers, analgesics, and then try to relieve your headache. But if you are having repeated headaches, like say every now and then headaches are coming in a week 2-3 times, or for no reason, like many times people say, okay, because I may be under stress, I may not have slept. So of course if you haven't slept adequately or there is too much stress, one can get headaches. But if there are no obvious reasons and still you get repeated headaches, don't ignore that headaches. Consult a neurologist, because again, by doing simple examination of the eye, what is called fundus examination, we can pick up the swelling, and that is the marker of increased intracranial pressure, and that can give us a clue that it could be a case of idiopathic intracranial hypertension. And again, very simple medications can bring down the pressure and preserve the eyesight. So that is the first message I would like to give here. And then don't think that it will go away, and sometimes the patients may have just visual loss for few seconds, transient. So you are just doing normal things, and suddenly for some time, few fraction of seconds or few minutes, the vision is affected, and then the vision comes back. Again, you may think, okay, fine, anyway, I'm totally normal, why should I see a doctor? But this could be a warning that pressure is building up, and that's the time you can see the doctor. Sometimes other symptoms like double vision may occur, sometimes tinnitus, that is sound in the ear, may occur. So these additional symptoms are not very common, but along with the headache, these symptoms also can occur in this condition. So in summary, anyone who has repeated headaches over, say, few weeks or few months or even longer, for which there is no obvious cause, of course it can be a migraine, but still don't assume that it is migraine. Even if it is migraine, it needs treatment. There are good medications to treat that also. So at least get the doctor evaluate you, make sure there is no swelling inside the eye on the optic nerve, and if it is there, we can further test may be required, like brain scanning, to rule out other causes of raised intracranial pressure. And then if the brain scan is normal, we do a lumbar puncture, CSF, to measure the exact pressure, and depending on the pressure we start treatment. In most cases the medications are enough, and this condition is more common in those who are overweight or obese. So weight reduction of, say, just 1 or 2 or few kgs can go a long way and can help people with this condition reduce the pressure. But of course, weight reduction is one of the treatments. In most cases, medications also will be given. So it's a combination of lifestyle modification with medications, and a small percentage of people, they may not respond to weight loss as well as medications. So for them, there is something called as shunt surgery, where the CSF is diverted and then the pressure reduces. So that need for surgery is there only in medically refractory cases, not all cases. But the thing here is that it is a treatable cause. So the raised intracranial pressure we can treat and prevent blindness. But if left untreated, it can lead to blindness, which is not desirable by any person or for any person. So in summary, if there is headache for which there is no obvious cause, consult a neurologist, and then make sure that it is not IIH. And if it is IIH, proper treatment can cure this condition and prevent blindness. So I hope you learned something new from this topic, and thank you.